All right, cinco. Um, what sort of model do you want to do to check quantitative dependent variables? A multiple linear regression, right? Standardized mortality ratio equals what? Observed number of deaths divided by the expected number of deaths. Um, Beware of all-cause mortality. Lower extremity pain when a person sits is associated with what? Lumbar stenosis, right? If you suspect lumbar stenosis, what sort of imaging should you get? Get an MRI of the spine. In mildly suppressed TSH, what do you want to do? Recheck the thyroid function test in about 2 months. If your patient has a concern for xerostomia, what should you ask them? Do you wake up feeling dry? Do you want some water when you wake up, for the most part? If someone has intermittent reversible airway obstruction, what do they most likely have? Asthma. So you need to get them to do a methacholine challenge test, by the way. Motivational interviewing. What is this a good question? What will you lose or gain if you give up drugs or alcohol or whatever? Yeah, that's a good question. It's key. Keep it in mind. Um, what is a good indicator of motivation to change? If you see the effort to stop at least, right? They might not succeed on the first go or the 20th go, but if you see the effort, then that's an indicator of motivation to change, right? If someone comes in your clinic like spring or summertime with a vague rash, what sort of bug should be on your differential? Tinea versicolor. What do you use to treat tinea versicolor? Topical ketoconazole, typically. If your patient has a suspicion for testicular cancer, what sort of imaging should you get? Scrotum ultrasound. How do you treat neonatal gonococcal conjunctivitis? Topical erythromycin. What should you do for someone with symptomatic gallstones? What sort of scan? A HIDA scan. If someone has, a little baby has diaper rash, what is the technical name of it? Candida dermatitis, right? You treat that with topical antifungals like clotrimazole, right? If your patient has an acute aortic dissection, you're in the ER, what medication do you definitely want to give? An IV beta blocker. Do you know any good examples? Esmolol, right? What's the first step in treating vulvodynia? Cognitive-based therapy. What sort of ketoacidosis should you suspect in a drunk person or someone with a history of like stumbling around in the streets late at night or being found on a bench or a park, something like that? Alcoholic ketoacidosis. What are the two main things you do to treat someone with alcoholic ketoacidosis? Give them IV fluids and thiamine. You're in the ER and you just intubated a patient, but notice lack of air sounds on one side of the lobe. Okay, what should you do? Retract the ET tube, right? If it's past the main bronchus. If someone has a pneumothorax, how do you treat? With a chest tube, right? All right, here's HSIL, break it down. LEAP, colposcopy, break colposcopy down. SIN 2-3, management. No SIN 2-3, break it down. 21 and 24, repeat colposcopy in cyto Q 6 months for 2 years. Or, if it was If they're 25 and over, management, okay? Now, you're in your OB-GYN clinic and you suspect someone has placenta previa. What sort of imaging should you do? A transvaginal ultrasound, right? If you suspect amniotic fluid embolism in a postpartum female, what would she most likely present with? Trouble breathing, acute hypoxemia, right? A Cobb angle less than what is fine and doesn't need follow-up? Magic number 40. Cephalexin for acute cystitis and asymptomatic bacteria is fine during pregnancy. True or false? It's definitely true. Give that cephalexin for that acute cystitis and that pregnant female doctor. Just kidding. All right. How do you treat pyelonephritis in pregnancy? Ceftriaxone, right? How do you treat septic abortion? Suction curettage, right? What is a risk factor for Erb's or Duchenne's palsy? Macrosomia. If you suspect vaginitis over the phone interview with a patient who just called in, what should you do? Get them into your clinic, right? What is a contraindication to organ donation? There's basically a bunch of them, but you should know some general ones. Ones like if they obviously have some weird disease, immunocompromised, or a bunch of granulomas or TB or all over that stuff. If they're less than 18, and if they're being coerced or getting money or have psychiatric issues, right? If you suspect that your patient has a RCC, renal cell carcinoma, what sort of imaging should you get? An abdominal CT scan, right? All right. Quotes 33. If you see a cystic mass, a complex enhancing mass, what should you get? Or what should the patient get? A nephrectomy, right? All right, so you're at your GI clinic. Your patient had H. pylori status 1 month of triple therapy, and you want to confirm that the H. pylori is gone. So what two things could you potentially use? Urea breath or fecal antigen, right? If someone has contracture of the joint capsule, what's their most likely occupation and how do they present? Painter with a shoulder pain, right? Or someone constantly with their shoulder moving around and whatnot. Okay. And how do you treat contracture of the joint capsule? You rule out, range of motion exercises for contracture of the joint capsule. True or false? Pioglitazone can worsen heart failure. It's definitely true because pioglitazone is a thiazolidinedione, and thiazolidinediones can worsen heart failure. Does Candida endophthalmitis risk come from central venous access? Yeah. And how do you treat Candida endophthalmitis? Vitrectomy and symptomatic amphotericin B, right?